Assalamu alaikum dear doctors. In this video I am discussing non-accidental injury NAI. First, NAI can present as musculoskeletal complaints frequently seen with bruising. Remember, bruising is an important sign for diagnosing non-accidental injury. Second, fracture, especially spiral or metaphyseal, more commonly in the underage 3 group. Number 3, periosteal reactions from rotation injury. 4, dislocation especially of the elbow. Presents with old bruises on limbs and has retinal hemorrhage. Number 5, a CT scan may show acute or chronic bleed in the brain. Skeletal bone survey indicates presence or heel fractures. So, retinal hemorrhage, CT scan finding acute or chronic bleed in the brain and present or healed fractures on skeletal bone survey. These are the important signs for diagnosing non-accidental injury. Now, there are some questions come on FOP exam. First question is that case of 2 years female child, she is quiet and withdrawn and reluctant to bear weight. She had bruises and petechiae on calf muscle. On examination, she is thin, crying when moving her left leg. There is no organomegaly. So, what is the diagnosis? Here, diagnosis is non-accidental injury because the support mechanism of non-accidental injury, the description is telling non-accidental injury. If we exclude the other points that idiopathic thrombocytopenia should precede by upper respiratory tract infections, fever, petechiae all over, mainly prominent on both. So, in ITP there will be a history of upper respiratory tract infections. Septic arthritis, one joint hip only is present. In Hannah's colon purpura, there is extensor and buttocks, there is maculopapular rash is present. So, final diagnosis is non-accidental injury. Next question is that you are junior doctor and young parents brought their baby with spiral fracture of humerus, what to do? So, spiral fracture of humerus, that is confirm the diagnosis non-accidental injury. First, we initially do call senior registrar. Remember, call senior registrar or call the consultant is the initially we do for non-accidental injury. There are some examples of non-accidental injury. First, fractures. Fractures are including spiral fracture of humerus, metaphyseal fracture of femur, posterior rib fracture, callus formation more than 42 days, fracture of clavicle in age more than 1 month. And skin, what are the non-accidental injury? These are oval-shaped burn, bruises behind ear, pinna bruises, human bite, frenulum tear, cigarette burn, retinal hemorrhage more than 42 days. So, this is the list of non-accidental injury. This is all about NAI. Please do subscribe and share my channel. Thank you.